that then.
Okay. Well, I won't officially start the meeting until I get the word from you, Kevin.
All right, bear with me 1 second. Okay, I believe we are started.
Okay, right. Welcome to the first Hampshire Local Outbreak Engagement Board meeting. Before we start, I need to just read out a few comments that I probably didn't read out as thoroughly as I should have done for the Cabinet meeting. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being live streamed and will also be available for repeated viewing. I will begin by naming the members who are in attendance for the public record. During the meeting, if a member wishes to speak, they will indicate this to me and I will call them to speak. And the members present are myself, Councillor Keith Manns, Councillor Liz Fairhurst, Councillor Judith Grodowski, and Councillor Patricia Stallard, and Councillor Keith House. The running order of the meeting, we will accept apologies. I don't think that we have any apologies, do we? Are there any declarations of interests? And we have no minutes from the previous meeting, so we pass straight on to Chairman's announcements. My first announcement, I would like to take as item 1 what is on your schedule as item 8, the Local Outbreak Control Board attendees, and then we can formally bring Councillor House onto the board and mention other future members as well. I don't have any specific chairman's announcements except to thank the staff of the county that have done quite a lot of work under the Chief Executive and the Director of Public Health to get this particular committee together. It's been a rather confusing situation because it wasn't clear at the beginning from the government exactly what this board was meant to do, but the actual criteria are now set out in the annex to the Cabinet papers that we've just completed scrutinising. And my view is probably the best way of describing our view is that we're the public access, the link between the decisions being taken and how they're announced to the public, because a lot of what we do on this board would have been predetermined by the statutory responsibilities of the head of public health, the director of public health, and indeed on the advice, or indeed I would argue probably the directions of NHS, Public Health England. So with those announcements, as far as I know, there are no deputations. So we'll go straight to item 8, which is to consider and agree the process to invite additional attendees to future board meetings as set out in the terms of reference. The first is a representative of the main opposition group at the County Council, and I'd just on that point formally like to welcome Councillor Keith House, who's agreed to join the board. And secondly, I've spoken to the leader of Basingstoke City Council, District Council, Borough Council, Councillor Ken Rattigan, who's agreed to be the other leader of a district council on the board. He's agreed to do that. He will come along to the next meeting, I hope, or dare I say, take part in the next meeting, because you don't come along anymore to these meetings. One of the reasons for that is that I've tried to get a geographical balance with the Cabinet and the other representations across the county. And also in the case of Councillor Rattigan, if we were to look at a particular town or city within the county, the view is that Basingstoke is one that may be slightly more likely to have a repeat outbreak than perhaps other parts of the county. And the final thing, we need a non-executive CCG representative, which we've still got to sort out. So we'll cover that. I will cover that offline, and I will let the committee know if I, having discussed it with the various representatives from the NHS, a suitable person to do that. That's all I've got on the Outbreak Control Board attendees. Unless anyone else has to say, I'd just like you to approve those recommendations, and we go ahead on the basis of what I've just said. Councillor Fairhurst, Liz, you're muted. You're still muted for some reason.
I think this happened to Councillor Fairhurst yesterday, and it's not for want of trying. I think she had to rejoin the meeting late.
Yeah.
Apparently her screen freezes and she can't issue any instructions on the screen at all. She can't change anything.
Yes, well, and she can't probably write a note either. Well, look, Liz, we'll come back to you when things are sorted out. But apart from that, are you all in agreement with that particular recommendation that I've just made? Okay, we can move on then to the main part of the meeting, because I'm conscious of time, amongst other things, which is the local outbreak control plan. And can I ask Simon Bryant, the Director of Public Health, to introduce this item?
Good afternoon, Leader. Many thanks for your time this afternoon. I will quickly go through the outbreaking control plan. So the plan is before you in the appendix, and the plan sets out our response to the COVID-19 pandemic. And Hampshire County Council produced the local outbreak plan on time, due by the 1st of July. We had about 1st of July. We had about 3 weeks to write that. And part of that plan is to set up these boards. Very happy to talk through the plan in more detail. However, since I did that at Cabinet, I'm happy to take any questions on that rather than go through in detail.
Has any member of the committee, the board, have any questions at all? Are you happy then that the Local Outbreak Engagement Board notes the content of the local outbreak plan for Hampshire? If you could all indicate in the usual way by putting your hands up. 1, 2, 3. Anyone else? And myself, I suppose I should do that. Okay. All right. Thank you for that. And moving now on to the next item on the agenda, which I think is an oral report, is it not? Simon, I think you're back on with a current situation update, which you're giving verbally.
Yeah, many thanks. I wonder if it just might be useful, with your permission, Leader, to switch those items around, because I can talk about the data available and then talk about the current situation. Would that be acceptable?
Yes, I'm very happy for you to do that.
So if we move to the item called data sharing protocols, I've set out in that paper the sources of data that are available and that we'll be discussing at this board, and section 4 sets that out. So we've got the cumulative and daily cases by district and county are available, and I'll talk about the county data. We're now getting, and I think Councillor House raised this previously, the number of people tested positive, and the proportion of those. However, I would just like to say that website is going to be now ready on Thursday. I was told it's ready on last Friday, but it's now going to be ready on Thursday when I've got that information. We're also looking at some early warning signs, and so we've got a count of number of people who have contacted 111. This doesn't necessarily mean that they have got coronavirus, but what it means is they are ringing up 111 with respiratory type symptoms, which is an indicator that they may have coronavirus. And obviously we'll see more people ringing up than actually have the disease, but it's a good indicator and good early warning sign for us, and will also be really helpful during the winter as people phone up with those kind of symptoms which may have flu as well. Finally, we have the mortality data, or the death data. It's a little bit of a time lag because it's through the Office of National Statistics, and I will be giving that data. And I think very sensitively, we need to look at number of outbreaks here. And so we will give you the number of outbreaks and we can give that by district in a sensitive way so that we don't cause any issues locally for districts or for settings indeed themselves. So if you move down to the information flows, I thought it was really helpful for people to understand how the information comes through and what we are doing. So we're looking at cases, incidents and outbreaks set out in paragraph 7. So a case I've set out as one case with no particular implications for any setting. So that might be someone who has caught coronavirus, we don't know where, but they are at home and they have no contacts or workplace or anything like that, or just their family. An incident is one case in a setting requiring intervention, because what you'll be aware of, actually, we may not have an outbreak, which is 2 or more cases. What we're dealing with in the incident of one case in a setting requiring intervention. And it may be a lot of work. You'll seen on the news the issue in the pub in Gosport. Well, there was one case there, and it was actually how we supported that setting. And then an outbreak is 2 or more cases in one setting, with exception of care homes where we take one or more case because it's so significantly important. And this paper also sets out some of the escalation processes that are set out in the outbreak control plan and the levels work to. So level 1, we're working as per business as usual in public health, long established systems of working and supporting and working with the South East Public Health Protection Team. And we would set up an outbreak control team on a local level with the setting, with the relevant specialists, environmental health. The second level is about if that exceeds capacity, we might need to bring a little bit more resource. So we might call an extraordinary health protection board chaired by myself, just to see what else we need to do to provide support. And that might be another district providing some more environmental health support. That might be working through the council resources to say, actually, we need a little bit of more help on this area. And finally, level 3, if we're finding that the health protection board is not able to manage it, or the outbreak is still progressing, we would be working with the Local Health Resilience Partnership and the LRF to ensure that we bring that resource in, and absolutely the outbreak control board, outbreak engagement board here would have a role there. So we would suggest we'd be in contact with you, leader, and we would then agree the following actions, and maybe an extraordinary meeting of the outbreak engagement board. So I hope that sets out what data is available and how we're going to do that, and the escalation processes there. So if it'd be helpful, I could then move on to the current situation, if that'd be useful.
Yes.
So this is as of today. So for the county of Hampshire, we have 5,021 positive cases, with a total of 18 in the last 7 days. And just for clarity, the rate, so the rate per 100,000 to enable us to compare across different areas, the rate in Hampshire is 364.8 per 100,000. And within the South East, the lowest is Portsmouth at 232 per 100,000, and the highest being Kent at 493.8 per 100,000. So we're fairly in the middle. And if I can just say that Leicester had a rate of well over 1,000 per 100,000. So we're well below that rate. So we're watching that, looking at that at all different perspectives to make sure that if our numbers go up significantly or there's more in the last 7 days, we're very fully aware of that. And we look at that. District level data is much more unreliable due to the small number of cases. And you'll be aware on the news last week, they said the Isle of Wight is increasing by many 100%. Well, actually, if you go from 0 to 1, that's a huge increase, but actually numbers that small. We then have the number of daily tests, which is really important, and that's something that we've been pushing for a long time and now have. So with regard to the number of tests, the most recent data have is on a daily count, we had 1,244 tests completed, and then on the same day a positivity number of 4. So we can see that actually we're doing a lot of tests and a small number of positives. Moving on to that data around 111. So at the height of the pandemic, we had about 450 calls to 111. That's gone down to about 36 a day. So we can see that number coming right down, and we'll be watching that really closely, because if that starts to go up, that's an early warning sign that we might be seeing some more cases of respiratory disease. but again, that's coming down very, very nicely. So for deaths, the last date we have for deaths is the 26th of June, just because it takes a little bit of time to report the deaths and record them. And there were 2 deaths in that week in Hampshire, where coronavirus was mentioned on the death certificate. That came down from 8 in the preceding week and 17 in the preceding week. So you can see that coming right down. So that's also really positive. And we've had 1 outbreak in the last 7 days. And so we're just looking at how what that looks like. And we're managing that carefully in the setting. No cause of concern for anything other than within the setting. I will stop there, Leader, and happy to take any questions on the data or the process for escalation, if that would be helpful.
Yes, thank you very much, Simon. I think I'd just like to ask one question, and that is that I think it's quite important for this committee, this board, to have information on a timely basis, because I suspect one of the things we're going to have to deal with is comments from the press. And clearly, if you have information at hand, it makes it rather easier to avoid the sorts of issue that you mentioned with the Isle of Wight, where you end up with people in thinking that there's a huge problem, when in fact, because there's a 100% increase, which is meaningless, as you say, because it's gone from 0 to 1 or 1 to 2. And I also think it's not a bad idea, if we can, to do some of it in a sort of graphical formula to give us an indication of the trend. I do understand, though, the point you're making. When you get to these very low figures, the actual line does jump around rather a lot. But I think on a weekly basis, at least, rather than a daily basis, we should get a fairly good indicator. I suspect it's all going to flatten out over the next week or 2, and then we will see if there is an increase at all anywhere quite easily. It's just really for the ease for which the committee can actually see the overall position in very general form about what's happening. And then, of course, all members of the board will have the right, if they wish to do so, to communicate with you as to whether there is a particular worry in their particular area, such as children's services, adults, or generally across a particular part of the county. Judith.
Thank you. Yes, there was some very interesting information there in Simon's verbal report. Also, lots of information available at the links in agenda item, is it number 7? I haven't got that up on my screen at the moment, which would have answered quite a lot of the questions that I've been receiving, and I know that the Public Health Department have been receiving from members and from the public. One of the problems with having lots of information is that the more you have, the less easy it seems to be for people to find it. So I wonder if we can disseminate those links. I know they're in the report, but could we disseminate those links perhaps by email to all members to assist them in handling simple inquiries from their residents who are concerned about cases in their area, in their district, because the district information is already on there. And that reports to this committee in future perhaps could be written and then again also disseminated, so that as much information is going to local members who are in touch with local residents as early as possible, and then perhaps the more difficult questions could then come in to public health or comms or wherever to be dealt with individually.
Thank you, Judith. You've reminded me of something else. I was on the phone to Maria Miller yesterday on another matter, and she made a point that she would very much like to see on a constituency basis the information that we've got, and you can understand why. Simon, is that a possibility that we can, because I'm meeting up with the MPs on Friday, and if we can actually give them some indication that we will provide them with appropriate information for their constituencies where that's possible.
Yeah, if I may respond to the couple of points you made, Leader, and then Councillor Grajewski. Yes, you're absolutely right. We need data on a timely basis. I'd like to assure you that I review the data on a daily basis, 7 days a week, to ensure that anything that may be going in the wrong direction, I'm on before you would know it. And obviously I've raised that with the Chief Executive and yourself and Kantskrevsky as the lead member for public health, if there was anything to be concerned of. You're absolutely right. We need to make that public, and I was working on it very early this morning to make sure that the data was up to date, and in future we'll have that in a report. I just wanted to check because we'd had the papers setting out what we're going to get, and I'll do that more fully. I think I'm mindful of political and MP constituencies slightly different from districts, and if I keep cutting the data in different ways, that becomes quite challenging. Districts are straightforward and easy to do, and we do that, and we can make that available, and very happy to do that. I think we need to be really mindful that it's absolutely right to share this data with those people. What it doesn't do, I think this will help the public make a decision about what level of risk they're willing to take. It's not about that. Actually, we need the members of the public, I think, as Councillor Gruevski said in Cabinet, to social distance, wash their hands and wear face coverings. And actually, if we can keep to that message, and the data is to help us manage the pandemic and look at different ways that it's spreading, rather than to support the public to make risk-based decisions, because I think we may have a different view of what's risky and what's not risky.
Simon, that's fine. I think I may, judging from my previous existence, what the MPs want is to know when something's happening in their constituency out of the ordinary. And what I like to be able to do is give them an assurance on Friday that if something like that happens in their patch, as much as we can, we will pass that information on to
Absolutely,
them.
absolutely.
I don't think that the more the general information, some of it will be available through the normal way we communicate to everybody. But I think that's what they're, so if you look at it from the point of view, if you were sitting as the MP for wherever, Meon Valley or whatever it is, you'd want to know if something's happening in Meon Valley. And indeed, in that respect, they should help us, because the press will contact them. And you can always give a holding response saying, well, I'm not aware of anything yet, but I have been told that if anything happens in our patch that is considered to be significant, the Director of Public Health has agreed through the County Council to provide me with that information. So at the moment, it's fine. Or indeed, if there is something, they can then give a response.
Can I?
That's really what they're on.
Would you mind if I essentially come back in here and absolutely agree with you? That's right. Sometimes we hear a lot of noise and rumours that there is a case in X, there is a case in Y, and obviously sometimes it's someone thinking they've got coronavirus and it's not actually the case that they have got it. So we just need to, I'll work on confirmed cases and situations. I won't be working on hearsay. And it's just sometimes that goes through to the MP because it makes so much noise, and we just need to manage that as well. But I take that point on and we'll take that forward.
That's fine. Okay. And the final point I'd make is that I think that communication also applies for us to have a way of contacting probably the leaders of the county, of the district councils. Obviously, with Keith here, he's probably in a position to give us an indication of the sort of things he would want if he was a leader at a council. That so again, they act as they know if they're contacted exactly what the position, or they have confidence that they will get the information.
Yes.
But we'll probably discuss that at the next meeting in more detail when we've got Ken here as well. Judith.
Yes, Simon makes a good point. At least I think this is the point that he was making, that we don't really want people to be influenced by the numbers, i.e. There aren't many numbers in our area. For instance, I looked yesterday, and in Hampshire, I can't remember the exact numbers, the increase of cases from the day before, but for Eastleigh, there were none in 24 hours. That doesn't mean to say that coronavirus has left Eastleigh. On the other hand, sometimes numbers are good, because I was talking to a gentleman at the weekend who said, oh, well, there are hardly any cases in Chandler's Ford, are there? So I said, well, I'll send you the link to the website. We've had 10 deaths in Hiltonbury. Have we really? And all of a sudden, it was real. And I think, as somebody said to me, who might not actually want to be quoted in this meeting earlier this week, treat everybody as if they might have coronavirus. And, that's the best thing to do. So, it's getting the balance right. It's information is good on the one hand, but sometimes not so good on the other.
Keith.
I agree entirely with Judith's comments. It is about this realism, isn't it, that we need to have, but avoiding people getting complacent, because the real risk at the moment is that people see very low numbers and think, oh, well, it's okay, we'll go back to how life as it was, and then suddenly you have a massive problem. But equally, it's not following the headlines in the tabloid press. I mean, there was a silly scare story, and I think it was the Daily Express. Someone sent me a cutting a couple of days ago electronically, and it was just utter nonsense. It was exactly the point Simon was making about a jump in percentage terms, which was meaningless because it was a small number being increased to another small number, not a large number being increased to an enormous number. So we want to be able to give that reassurance that it is about just making sure you do wash your hands, you do wear your face mask in Tesco, you do keep an appropriate distance from people, and then within that context, chances are you should be okay if you're sensible. And that increasingly applies through the summer as people get back into doing travelling around the country and elsewhere. And that mixture of reassurance without complacency feels to me to be the point we've still got to get to, particularly if we want businesses to survive and growth to start again so that we can recover our economy.
No, I entirely agree. Referring back to my previous occupation in aviation, you measure the accident rate of the number of accidents per 1 million flying hours, and it's pretty low now. It's 2 or 3 aircraft that crash per 1 million flying hours. So you only need one more, and it's gone up by 50%. And of course, that's exactly what gets in the paper. Aircraft flying is not as safe this year as it was last year. There's been a 50% increase in the accident rate. So I understand that point entirely. Are there any other comments that people want to make? Because we have a recommendation here that's been put before us. It is recommended that the board should note the contents of this report and the data sources alongside a verbal update on the current data. You're all happy with that? Jolly good. Okay. I think you're all putting Liz, I don't know whether you're back with us at all now.
I'm back now. I seem to have to keep logging out, going out completely and coming back in.
Have you had a word with IT at all about
Not
that?
yet, because this is only the second time it's happened, so I will try them.
Good. Well, look, that, as far as I can see, is all we've got on the schedule for today. I didn't expect too much because this is really just to get us together, as it were. We'll have the next meeting. I'm not certain when the next meeting is likely to happen, Simon.
So I think we're scheduling for monthly with anything urgent to be scheduled by exception, because I think that will give us a flavour of where we're going. And as I said, we are monitoring that on a daily and a weekly, all the time. So if you need to raise something, I will be in touch with yourself and the chief executive to say, actually, would it be helpful to call a board, so that we're well prepared for any action we should need to take should we get to a situation where we need more dramatic action than the Health Protection Board is able to do.
Thank you, Simon. I think that's very reasonable, and obviously we'll let members know when the next meeting is. Patricia, did you have something, a point?
Yeah, I just wondered, Simon, when might we expect our regular updates from you for this particular board? I don't mean the next board meeting, but I think we discussed earlier on in this meeting that it would be extremely useful and helpful if we, the board members that is, if we had regular updates. Now, I wondered when we might get that first one from you. And I do appreciate what has been said about small numbers creating potentially volatile situations where people misinterpret those small numbers. But nevertheless, I do think it's absolutely critical that the board members here today do have those numbers, albeit they very small in cases, and also on those reports that you will draw what I call exceptional trends to our attention, not necessarily waiting for the next board meeting. I want this information on a week-by-week basis. I do take your point, Keith, about MPs. I know my own MP rings me up regularly to want an update on children's services or whatever it might be. And I think that's perfectly possible for any MP, and indeed even a county councillor, to make those kind of calculations from district figures. But I want to know, my personal thing is I want those updates to be snappy. They don't have to be wordy. They could be bullet point. I'm fine with that, but I do want them to be detailed. I want the information.
So would it be acceptable if we have a health protection board that currently meets weekly, that we do a summary from that for members of this board, and currently meet weekly? Obviously, if that changes because we need to meet less often, we would do, but that feels like a reasonable time scale to manage that, and then you can we'll get a summary from that with a little bit of narrative, which we go around to the board members.
Perfect.
Okay.
That's good. Judith.
Yes, that's all been covered, and it is something I think that Simon and I were talking about earlier in the week, weren't we? On how the board that he chairs disseminates its information. So I think we've got that covered.
Yeah, I think you're right. Every week from your board, but if there is anything out of the ordinary that's happened somewhere, you let us know about it. Liz.
Of course.
Yes. Sorry. Yes, Simon. You're not suggesting we have a meeting every week, are you? You're just suggesting you'll send us an email giving us the details.
Yes.
Brilliant.
Absolutely.
Thank you.
Meeting every month, update every week, and anything exceptional that's happening anywhere to let us know. And those are probably the sorts of things to let the MPs know as well. Okay. Judith, one last go.
Yes, can I just say, I mean, Simon he doesn't hesitate to contact me if there's anything, although occasionally Peter Henley's got in on Twitter first, but he is very timely, you know, and I don't actually think that he sleeps. So, you know, it's 24/7 service from our public health director.
Thank you.
Okay. Are we all happy? Thank you all very much indeed. We'll meet again at some time next month and we'll receive regular reports about how things are going in the interim.
Yeah.
Thank you. And particularly thank you, Simon. Okay.
Thank you.
Cheers.
Bye-bye.
Thank
Bye.
you.
Bye.
Bye.
And Kevin, if you could ask the webcast operator